In this video, we're going to talk about something many women and men over 60 deal with but rarely discuss: frequent gas. Now, I know it might feel embarrassing, but I want you to listen closely. Passing gas more often, especially when it's smelly or uncomfortable, isn't always just a funny little moment. It can be your body's way of sending you a warning sign. I'm Dr. Margaret, and after more than 40 years of helping senior women with their health, I can tell you this: your body never stops talking to you. Even through gas, it may be whispering about deeper issues with your digestion, your gut health, or even your medications. In this video, I'll reveal 6 silent health signs that frequent flatulence may be pointing to. And trust me, number 6 might just surprise you. Before we dive in, I'd love to know, where are you watching from today? Just share your city and state in the comments below. And if you've discovered any simple tips that help with digestion or gut health, please share them too. Your advice might be exactly what another viewer needs. Point 1. Your digestive enzymes have slowed down. My friends, let's go back for a moment and think about how things used to be when we were younger. Remember those days when you could enjoy a big bowl of ice cream, a hearty plate of beans, or even a late-night burger, and your stomach didn't complain too much? Back then, your body was producing plenty of digestive enzymes, those little helpers that break down the food you eat so your body can absorb nutrients and get rid of the rest. But here's what many people over 60 don't realize. Our bodies naturally make fewer enzymes as we age. It's not your fault, and it's not something you did wrong. It's just the way our biology changes over time. Without enough enzymes, food doesn't break down as smoothly. Instead, it sits longer in your stomach and intestines. And when food sits, it ferments. And when it ferments, yes, you guessed it, it creates more gas. That's where those uncomfortable moments of bloating, pressure, or sudden gurgles in your belly come from. Now, the tricky part is that this isn't only about embarrassment. When food isn't broken down properly, your body doesn't get all the nutrients it needs. That means your muscles might weaken more quickly, your skin may not look as fresh, and your energy levels might drop. You may even notice changes in your memory or thinking, because your brain needs those nutrients too. In other words, something as small as passing more gas could be your body's way of saying, "Hey, I'm not getting what I need." The good news is that there are gentle ways to help your digestion. Some people find that adding enzyme-rich foods helps. Pineapple, papaya, sauerkraut, and other fermented vegetables can naturally give your body a boost. For others, talking to a doctor about digestive enzyme supplements makes a big difference. Even small changes like chewing your food more slowly can help your stomach handle things better. Point 2. Hidden food intolerances are catching up with you. Now, here's something many people are surprised to learn. Even if you've eaten a certain food your whole life without trouble, your body can suddenly start reacting to it after 60. That's because as we age, our gut lining becomes more sensitive, our enzyme levels drop, as we just talked about, and our immune system doesn't respond the same way it once did. Put those 3 changes together and what happens? New food intolerances show up, often in the form of, you guessed it, more gas. Think about it. Maybe you always enjoyed a glass of milk with dinner, or a slice of bread with butter, or even sugar-free gum when you wanted something sweet. Suddenly, those same foods leave you feeling bloated, gassy, or uncomfortable. It's not always dramatic. You may not break out in hives or double over in pain. Instead, your body whispers with constant little reminders: frequent flatulence, rumbling in your belly, or a feeling of heaviness after eating. Why does this happen? When your gut can't properly digest certain foods, like dairy, lactose, wheat, gluten, certain vegetables, or artificial sweeteners, the leftovers sit in your intestines and ferment. That fermentation produces gases like hydrogen, methane, and sulfur. And that's why sometimes the gas is not only frequent, but also stronger in odor. Here's the important part. Ignoring these signs can lead to more than just embarrassment. Unaddressed food intolerances can cause ongoing inflammation in your gut. Over time, that can contribute to something called leaky gut, and even trigger autoimmune problems. So when your body is reacting to a food, it's not being dramatic. It's warning you. What can you do? The first step is paying attention. A simple food diary can help you see patterns you might otherwise miss. Write down what you eat and how you feel afterward. You may notice, for example, that every time you have milk you feel gassy. Or maybe bread and pasta leave you bloated. Once you spot a pattern, you can try cutting that food for a few weeks to see if your symptoms improve. Of course, it's always smart to do this under your doctor's guidance, especially if you're dealing with multiple health conditions. Point 3. Your gut bacteria are crying for help. Let me tell you something important, my friends. Inside your belly lives an entire community, trillions of tiny bacteria that make up what we call your gut microbiome. Think of it as a little city inside you, full of helpers that digest your food, protect your immune system, and even affect your mood and brain health. When this city is balanced and thriving, digestion runs smoothly, gas is minimal, and you feel healthier overall. But as we get older, especially after 60, this community often starts to shrink and lose its balance. Why does that happen? Age is one reason, but so are the medications many of us need to take, like antibiotics, antacids, or even blood pressure pills. Add in a less varied diet, lower physical activity, and the stress that life can bring, and suddenly the good guys in your gut don't have the strength they once did. When the helpful bacteria fade away, the troublemakers step in. These troublemakers are the ones that ferment food poorly, create extra gas, and leave you feeling bloated and uncomfortable. And here's the part you may have noticed. The gas smells stronger, lingers longer, and happens more often when your gut bacteria are out of balance. But gas isn't the only sign. You might also notice constipation, diarrhea, skin flare-ups, or even feeling more tired than usual. Yes, your gut health connects to all of that. When your gut bacteria aren't balanced, it's not just your stomach that suffers. It's your whole body. Over time, this imbalance can even raise your risk for serious conditions like diabetes, irritable bowel syndrome, and memory problems. The good news is you are not helpless here. You can start to nurture your gut like you would a garden. Probiotic-rich foods like yogurt, kefir, sauerkraut, or kimchi can add healthy bacteria back in. Prebiotic foods like oats, bananas, garlic, and onions act as fertilizer to feed the good bacteria. Drinking plenty of water, getting gentle exercise every day, and managing stress also keep your microbiome strong. Point 4. Your medications may be stirring things up. Now, here's something many of my friends overlook when they start noticing more gas than usual. The pills sitting right there in the medicine cabinet. By the time we reach our 60s, it's common to be taking more than one prescription. Blood pressure tablets, cholesterol medications, arthritis pain relievers, thyroid pills, maybe even something for diabetes or bone health. All of these are prescribed for good reasons. But what many people don't realize is that medications can quietly change how your digestive system works. Some medicines slow down the natural movement of your intestines. Others interfere with stomach acid or upset the balance of your gut bacteria. And when food sits too long or isn't broken down the way it should be, it gives bacteria extra time to ferment it. The result? More gas, more bloating, and sometimes even constipation. Common culprits include antacids, calcium channel blockers for blood pressure, opioids for pain, certain antidepressants, and even NSAIDs like ibuprofen. And here's a surprise, even fiber supplements, which are often healthy, can cause a lot of gas if your body isn't used to them, or if you take too much at once. The tricky part is that these side effects don't always happen right away. You might start a new medication and feel fine for a while, then slowly notice your digestion feels heavier, or you're passing gas more often without realizing the two are connected. That's why so many seniors just brush it off as normal aging, when in fact the medication is playing a role. But don't worry, you don't have to stop taking your medicine. The key is awareness and communication. If you notice digestive changes after starting or changing a prescription, bring it up with your doctor or pharmacist. Sometimes switching to a different brand, adjusting the timing of when you take it, or lowering the dosage slightly, with your doctor's approval, can make a world of difference. Remember, your medications are supposed to help you feel better, not make you uncomfortable behind the scenes. So don't be shy about asking questions. Your health is too important to stay silent, especially when something as simple as gas might be telling you that your body and your medicine need a little adjustment. Point 5. Silent constipation could be the culprit. Let's talk honestly, my friends, about something most of us would rather avoid: constipation. We all know what it feels like when days pass without a proper bowel movement. But what many seniors don't realize is that constipation isn't always obvious. You can still go regularly and yet not be fully emptying your bowels. That's what doctors call silent constipation. Here's how it happens. As we get older, the muscles in our intestines lose some of their strength. Add to that less physical activity, not enough water, certain medications, and a diet low in fiber, and your digestive system simply slows down. Even hormonal changes after menopause can play a part. When waste moves too slowly, gas builds up behind it, just like water backing up behind a clogged drain. That trapped gas has no choice but to push its way out, and it often comes with bloating, pressure, or more pungent smells. The tricky thing is, silent constipation doesn't always show up as no bowel movements. Instead, you may notice stools that are smaller, harder, or more difficult to pass. You might feel like you've gone but still feel heavy or full afterward. And yes, more frequent, more uncomfortable gas can be one of the biggest signs that things aren't moving the way they should. Why does this matter? Constipation isn't just uncomfortable. Over time, it can lead to hemorrhoids, diverticulosis, and even bowel blockages. More than that, it can affect your daily life, making you less interested in going out, eating with friends, or staying active. And I know many of you want to keep enjoying your independence without these kinds of quiet problems slowing you down. So what helps? The first and most powerful step is hydration. So many seniors simply don't drink enough water, and without it, your colon dries out and slows down. Adding fiber helps too, but it should be gradual. Fruits, vegetables, beans, and whole grains are best. Gentle movement like walking, stretching, or light yoga keeps the intestines active. And if needed, your doctor can suggest safe options to get things moving more regularly. Point 6. It might be whispering about a bigger issue. Now, my dear friends, here's where I want you to pay even closer attention. Sometimes frequent gas isn't just about slowing enzymes, new food intolerances, or even constipation. Sometimes it's your body's way of warning you about something more serious, like irritable bowel syndrome, IBS, or diverticulosis. IBS is one of those conditions that can sneak up on you. It's not life-threatening, but it can absolutely change the rhythm of your daily life. One week you feel fine, and the next you're dealing with gas, bloating, cramps, constipation, or diarrhea that seems to come out of nowhere. And it's especially common in women over 60. That unpredictable pattern can make you nervous about eating out, traveling, or even joining social gatherings, because you just don't know when your gut will act up. Diverticulosis is another condition that many seniors discover only later in life. It happens when little pockets form along the walls of your colon. Most of the time, you don't even know they're there. But here's the catch. Those tiny pockets can trap bits of food or waste. When that happens, fermentation begins and gas builds up. For some people, this is one of the earliest signs before anything more serious develops. If one of those pockets becomes inflamed, it leads to diverticulitis, which is far more painful and dangerous. That's why paying attention to these smaller signs like gas and bloating really matters. The key here is not to ignore what your body is telling you. Many seniors brush off changes in digestion as just old age, but that's not always true. If you notice that your gas is constant, stronger, or comes with other changes, like abdominal pain, sudden shifts in bowel habits, unexplained weight loss, or even changes in your appetite, please don't wait. Talk to your doctor. The earlier these conditions are recognized, the easier they are to manage. Both IBS and diverticulosis can often be controlled with diet changes, lifestyle adjustments, and sometimes medications. But you can only get that relief if you know what you're dealing with. So remember this. Your body is always speaking to you, even through something as simple or embarrassing as gas. Listening early means living more comfortably, more confidently, and with better health. My dear friends, I hope by now you see that frequent gas is not just something to laugh off or hide. It can be a gentle signal from your body, reminding you to pay attention. Whether it's slowing digestive enzymes, hidden food intolerances, changes in your gut bacteria, side effects from medications, silent constipation, or even more serious conditions like IBS or diverticulosis, your body is always speaking. The question is, are we listening? The truth is, getting older doesn't mean we have to give up comfort or accept every little problem as just aging. You've worked too hard and lived through too much to let something like digestive trouble hold you back from enjoying life. With the right awareness, small changes, and honest conversations with your doctor, you can feel lighter, healthier, and more confident. I want you to remember this. Your health is not about perfection. It's about paying attention. Every little step you take to care for yourself adds up. Whether it's drinking more water, moving a little each day, or choosing foods that make your gut happy. You deserve to feel comfortable in your own body. So don't dismiss what may seem small. Even gas can be a whisper worth hearing. Take it as a reminder that your body still needs care, still needs love, and still needs you to listen. Now I'd love to hear from you. Have you noticed changes in your digestion as you've gotten older? Share your thoughts in the comments. I promise you're not alone. And don't forget to subscribe, so you can keep learning simple, practical ways to take care of yourself and live your best years with comfort and dignity.